In the last CD, you learned about introductions, which is a nice basic tool to have. Now it's time to bring in the sledgehammer, qualifying. Qualifying can make the difference between a good hospice sales rep and a great one. It is the best tool you have for identifying the person who calls in the referrals in each account. It's also the best tool for getting past gatekeepers and zeroing in on the potential for referrals. Are you ready to learn about qualifying? Let's get into it. The fourth module, qualifying. Lesson 1, prospecting.
Okay, so now you're ready to get out there and start developing some new accounts. We're going to be looking at what it is to prospect and what it is to develop those relationships that will result in those prospects becoming referral partners. The first thing that we want to talk about is not trying to be all things to all people. What we see all too often is salespeople, and I think I referenced this earlier, getting burnt out because they try and go all over. They try and be all things to all people. They're very busy, but they don't have a good plan. And one of the things we find is when they're prospecting, they pretty much look at it as being the whole world as their universe of potential prospects. And that may be, but we're going to tell you that there are a short list of their best prospects. So your job one when prospecting is to select the prospects that are going to be on your prospect list. Do not do the old bundles of business cards with rubber bands around them, and when you got some extra time to prospect, you pull out the bundle and you start flipping through looking for, oh, that looks good, I think I'll go call them. Total waste of time. One random call placed somewhere is very, very ineffectual. And if all you're doing essentially is going by there, getting shut down by the gatekeeper and leaving a brochure, well, you tell me how effective that's going to be. So you've got to pick those prospects which are your best prospects. And you need to have a list which is a finite number of prospects. It's a fixed number. Now you and your manager are going to need to talk about how long that list should be. If you have a brand new territory, then your list is going to be much longer than the person with a very mature territory who has a lot of A accounts to service. So figure out what that is, but it's going to be somewhere between 10 and 30 usually. Okay? No more than 30 top prospects on your list. And the reason for that is that you need to have at all times, a focus on developing new accounts and new business, but that's going to be a part of your time allocation. And as we talk further about time and planning and managing your time, you've got to know whether you're spending it with your A accounts, B accounts, C accounts, or prospective accounts. In this case, we're talking about the prospects. And we're talking about having a list that really has 3 ways that someone can get off the list, right? The first way is what? They give us a referral. Now that's our preferred way to get somebody off the list. If they give us a referral, they become a referral partner, and we then are a C account, and we're going to try and work them up the ladder to become A accounts eventually. So that's one way off the list. The second way would be that we determine that they're not a good use of our time. We qualify the account and determine that they're not a good opportunity. They're certainly not one of my 30 best or 20 best, or whatever your number is, prospects. So you cross them off and you can replace them. The third way would be that they move, die, retire, whatever it is. Okay, another reason to cross them off. Now here's the trick. You cannot add a new prospect to your list. Say somebody says, oh, hey, Mike, I was in the supermarket and I ran into Dr. Bob and I told him you'd come by and talk to him. Dr. Bob's not a customer of ours, right? To put him on your prospect list, I've got to cross somebody else off. Now you're thinking, whoa, wait, I just got a hot lead here and you're going to tell me I can't start working him until I take somebody else off? You bet. And why is that? Because here's the power in that process. For me to knock somebody off the list, I've got to be able to say that I went out and called on somebody that's on the list and I've asked them the hard question. What's the hard question? It's what's it going to take for you to give us a patient? However you word that, at the end of the day, I've got to be able to answer the question that I know because I've asked the prospect what it would take for them to entrust one of their patients to us for our care. If I don't know the answer to that, I haven't done my job. And here's what we find from some of the reps we've worked with. We get these reports back that say, you know what, it's amazing. I go out and ask that question and end up getting business. Go figure. Okay, you got them off the list. So by asking that question, you can either convert them into a referral partner or disqualify them as being one of your top prospects, but that makes the slot for somebody else to come on. So the process is such that you can focus on that list, have a plan in place to get to them on a regular basis, consistently calling on them, moving the ball forward, moving down that long list of interactions to get them to the point where they're going to start referring to us. What we know is that the only way that we can shorten the sales cycle is to have the most number of interactions. If I'm going out there once every 6 weeks or once every couple of months, I'm going to not have a very effective conversation, and I'm going to have a long sales cycle. So shorten the sales cycle, make it more consistent, have a plan, have a finite number that you're working on. Now, one other thing that I think is important to look at is when we're talking about prospects, a lot of organizations may say, well, it would be only for people who've never done business with us. Well, we happen to think that your dormant accounts, those accounts that have not referred a patient to us in the last 12 months, are just the same. They should go on that prospect list. They haven't given us a single patient referral in the last 12 months, and we know that they have the potential to be a good referral partner, then I need to treat them as one of my best prospects, not as a C account. Okay, so again, it's focusing on a finite list of people and then figuring out how to get them off the list so I can bring other ones on and constantly have what would represent my top prospects.
Lesson 2, qualifying.
We said earlier that qualifying is so important. It's the key to making sure that you're spending your time wisely. You're finding out, is this prospect, is this account worthy of my time and energy? Because the number one most scarce resource you have is your time. And for your organization, I can promise you, if you work for a hospice organization, you are never going to have too many salespeople. So there's always going to be more places that we could call on than we could ever possibly get to, because that's the nature of the beast. We're never going to have the budget, nor should we necessarily have the budget to have the city or your area completely just flooded with sales reps. So given that, you've got to figure out where's the best use of your time, and it comes back to qualifying and making sure that where you're focusing. We talked about having that list of prospects and that they're best prospects. How do we know that they're your best prospects? Because we've qualified them. So when qualifying, there's absolutely positively the first thing that you want to ask is this: who calls in the referrals for hospice care or for hospice patients? Okay, who calls in? Not who decides if someone needs hospice, who orders hospice, or anything else that might involve the physician, the nurse, the PA, or somebody like that. I want to know who physically sends the referral in. Calls it in, faxes it in, doesn't mind, but use the words, who calls in the referral for hospice. Bite tongue. Let them answer. Once you find out who that is, your next question is, may I speak to them? It's either yes or no. If no, I want to find out, I want to qualify further and say, when's the best time to get with them? And nail down when's going to be my highest probability time to come back and see them. It may be that you call and set an appointment. There's any number of ways you can get to them, but as soon as I know who calls in the referrals, my goal is to get face-to-face with that person, because they know what I need to know. They know what's important to their practice or to their facility. They know what's important to them, and they're the ones who pull the trigger. Now, many of us, and especially if you're new, you may be thinking along this way, think that we've got to get, if we're going to develop a physician as a new referral partner, then I got to get FaceTime with that doctor. And I'm going to tell you that I want to have FaceTime with the person who calls in the referrals first. Why? Because they know what's important to that doctor. And if I'm prepared and know what the issues are and what's important to that physician before I first meet them, I can have a very impactful, one-on-one, succinct sales encounter with the physician, and I'm not asking them questions to find out what's important to them and wasting their time and my opportunity of FaceTime with the physician. The other thing is that I've got to know what the relationship is with the person that calls in the referrals. That person, because they're the one who physically sends them in, has the ability to send them anywhere. And you're saying, well, wait, Mike, but if I sold the doctor on how great we were and the doctor said, I'll send you our next few patients, that's going to be a win. Well, talk to some of the people that have been out there doing your job for a while and find out how many times the doctor says, yes, we'll definitely use you, and you don't get the call. And here's one reason that could be happening. Doctor says, call Mike's Hospice. I like the guy, I like his hospice, let's give him a try. And the person calls the people they're already using. Now, if the doctor actually notices that the referral didn't go to Mike's Hospice, which is a big if, and if the doctor feels compelled to investigate further, which is an even bigger if, and they come in and they say, you know, Mary, I just noticed that we hadn't had any patients with Mike's Hospice, and I thought I'd ask you to refer somebody to them. All Mary has to say is look at the doctor and say, you know, Dr. Bob, I did try and call him, and that first patient they couldn't take. And they've called him a couple other times, and, you know, to be honest with you, I don't think they know what they're doing over there. Now, is the doctor going to go, oh, no, Mary, I think Mike, that guy that came in here, he told me why they're the best, and so I want to use them. No, they're not. He's going to depend on the person that he has calling in those orders, and he's going to say, okay, well, thanks, Mary, for doing your job. So if I don't have a relationship with the person calling in the referrals, I'm at risk. They also know all of the information that you need to know. Now, the second thing that you've got to kind of start looking at is when you start trying to get face-to-face with the person that calls in the referrals, is who's the gatekeeper in between you and that person? How much effort is it going to take you to get to them, and have we done our homework to know that there truly is a good opportunity represented at this location?
Lesson 3, dealing with gatekeepers.
One of the requests we get during our training programs and from reps we talk to all the time, and those that inquire or we run into at different places is, how do you deal with gatekeepers? Everybody's got their favorite story about the gatekeeper that's absolutely the best at what they do and how it's impossible to get through to them. We have a lot of folks asking us, Mike, we're seeing in our hospitals that they're not letting us get to talk to the case managers. They're prohibiting us from getting to the case managers. What are they doing? They're installing a gatekeeper. Okay? It's the same thing. So let's talk a little bit about gatekeepers. And the first thing that you want to remember is they're doing their job. Okay? They're not helping us at this moment. But think about if they're really good at doing their job and keeping people out, keeping all those pesky hospice salespeople from talking to whoever they're protecting, then once we've penetrated that gatekeeper, once we've had success and are getting referrals from that account, we want them to be as, the best they can be at that job. Because now they're working on our team, they're keeping all the competitors out. So, think about the fact that they're doing their job. Okay? Let's say, for example, that it's a physician practice, family practice, or whatever, and for whatever reason, they've been struggling with getting out on time. The office manager says, you know what, if the doctor stops talking to all these pesky salespeople, if we stop having these pesky salespeople come in, I'll bet we can get out of here on time. So she goes up to the front and she tells Wanda, you keep them out. This is your job. If you keep them out, we all get to go home on time. If you don't keep them out, we go home late, and everybody here is going to know it's your fault. Now you tell me, if you're Wanda, are you going to say no to everybody, but oh, I kind of like this guy, so I'll let him in. Well, I like that one. No, they're doing their job. So you've got to understand and figure out what their job is, where they're coming from, and everything else. Now, if it's just a personal thing with Wanda, Wanda the Window Witch, and she's difficult for you to get along with, and it truly is Wanda and not the facility or the policies or procedures or whatever, then maybe you've got to figure out when Wanda's not going to be there. So one strategy is to look at, when's Wanda there? Is the clinic open late on certain days and Wanda goes home? In which case you might be able to get access. Does Wanda take a lunch? Is Wanda ever out? So look at that and figure out, if you can't get through Wanda because of Wanda, that how you could get past her because somebody else is sitting in her chair while she's taking a break or while she's at lunch. There's all kinds of strategies there. Now, lest anybody, take this wrong, we get accused, of giving people the wrong strategies. We're not suggesting that you stalk anybody or stalk Wanda or wait for Wanda or Wanda's boss in the restroom or anything. But be creative, figure out when you can get there if truly Wanda is the problem. But most of the time it's not Wanda so much, it's just the job that Wanda's been given. So we've got to give a benefit to Wanda of why it is that we should talk to someone in their practice. If you're trying to get to see the doctor and Wanda's saying no, 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 maybe you want to be looking for that person that calls in the referrals. They're always going to be easier to get face-to-face with than the physician is. Okay, so think about, maybe I'm asking to see the wrong person. But the key you want to develop is a style that says, I'm here to work with you, Wanda, with Wanda. Okay, not butting heads, how I can get Wanda to let me go, but working with Wanda to find a way that you can get to the people in her practice or her organization that you need to talk to. So the first thing with that is being professional, being courteous, recognizing that Wanda's a person, okay? Respect Wanda and her job and work with her always with respect. Make sure you introduce yourself appropriately. Now, here's one thing you want to keep in mind is we have this tendency that we want to sell Wanda our hospice, and that's the wrong strategy because Wanda's not the person who's going to make a decision typically about hospice. So don't waste your time trying to sell Wanda on why you're the best hospice or why she should let you get through because you're the best hospice. Find out what's important to Wanda. As I said earlier, when we ask the question, who calls in the referrals for hospice, get a name. Ask Wanda, Wanda, when's the best time to get with them? If Wanda comes back and says, well, there's never a good time, they're always busy, then be prepared to ask a set of 3 questions. Well, I certainly can understand that, but is first thing in the morning, right before lunch, or into the day best for them? Is Thursday, is there a day of the week that's better? Okay. Ask questions, let Wanda tell you when the best time is. No guarantee you're going to get through, but at least now if you come back in on Tuesday afternoon because she said that's the best time to do it, and you try that a couple of Tuesdays and don't get through, then you can ask Wanda and say, Wanda, I really need your help here. You were so kind to tell me that the best time to get with Deb was Tuesday afternoons, and I've come back the last 2 Tuesdays and here I am again, and I just feel like I'm not doing my job because it hasn't worked out. What do you think? If you were trying to get some time with Deb, when would you come? And again, treat her as someone that you're working with, but get her started in the process of brainstorming with you. If you can get her on your side as an ally trying to get you two together, eventually she'll help you do it. But she's going to be less likely to get in your way. Now, there's no guarantee with that, but that's certainly one strategy that we always want to employ because 9 times out of 10, at some point, Wanda will be helpful because you didn't treat her poorly, which is what she's used to. Most people don't treat the gatekeepers with the respect and the common courtesy that you will. And that's going to go a long ways with Wanda. So remember that Wanda's doing her job, okay? So we can't ask Wanda to do anything that's going to put her job at jeopardy. So any strategy you come up with that would get Wanda in trouble is not going to be a good, viable strategy. But if you can get Wanda to work with you and brainstorm on how you might get that FaceTime with the person that calls in the referrals, then long term you're going to have an ally in that account and someone who's on your team. But don't overthink the whole gatekeeper piece. You know, we tend to think, and I can't tell you how many times that we have sales reps that tell us, oh, well, I've got this place and just the meanest person ever. They're just rude, right? And, you know, we find out that there's more to the story than that. But if you live with the idea that Wanda's just a horrible person and she's truly Wanda the Window Witch and she's the problem, then you're going to have that attitude, and guess what? You're going to be right. She is going to be a problem. So eliminate any of your assumptions about Wanda, eliminate any bad feelings, and truly work with Wanda to figure out how you can get to the person you're trying to talk to. You have a very valuable service to sell. You have, you know, hospice, and it's, again, our mission to make sure that people have the opportunity to have the gift of hospice in a timely fashion and from our agency. That's what's at stake. So get Wanda on your side, and then get Wanda to help you get to whomever it is you need to talk to.
Lesson 4, identifying the players and targeting the right people.
Another valuable skill that you need to be really good at is identifying the players in each account. Now, we talked about the gatekeeper, we talked about finding out who it is that calls in those referrals for hospice, but who else is a player in this account? Who else is a key piece of having the hospice conversation appropriately with the right patients in a timely manner? So start your account profiling and start tracking who's who. Okay, and now if you're not real good at remembering names, make sure you get the names and put them in your profile. If you're not good at keeping straight names and things, you can put little notes in your profile about what they look like or which person it is, so that you do know who they are and what their role is. And then start doing your homework and start asking the questions and find out, you know, the person that calls in the referrals, when you're asking them some of these qualifying questions, you're going to want to know what's important to them when they select a hospice patient, a provider for their patient. How do you match a specific patient with the right hospice to meet their needs? And these are all going to give you clues, but somewhere in there you're going to ask them, what's your process? Who's involved in that process? Because, again, we're talking to the person that calls in the referrals, but rarely are they the ones who identify the hospice patients and actually order hospice. So who does that in the office? Is it the physician? Is it the nurse practitioner? You know, is it the nurse? Who is it that makes those calls? And it may be multiple people, because I want to start filling out my account profile and knowing who the players are in there, and then start building my information about what's important to each one of them, because each one of them could be a very important customer for me, a referral partner within this one account. And as we know, you know, medical practices, skilled facilities, hospitals have different people doing different things. I mean, think of a skilled facility. In a skilled facility, it may be the director of nursing, it could be the assistant director of nursing, it could be the social worker who is calling in the referrals. Could be a clerk that works for one of them. Could be any one of those three who are actually determining a patient that would be appropriate for hospice and deciding we need to call hospice in for this patient. We need to know who that is. But we also need to know, like the MDS coordinator. They are rarely going to be the person who calls in the referral, but I can promise you that they know everything you need to know about what's going on in that facility. They know where the problems are. One of the things for a hospice working with a skilled facility is that we're able to resolve problems for them. Okay? My goal in a skilled facility is that their first thought is, if the state surveyor hits the front door, their first thought is, I hope they pull a chart from Mike's Hospice. Now, why is that? Because that's my goal, is for them to view us as a partner, and that the way that we operate in their facility is not going to put them at risk. That MDS coordinator knows what the problems are with existing hospice providers, and they know what they're working on as because of survey deficiencies or problems that have been identified that might lead to survey deficiencies, and many of those you can have a role in helping them resolve. So I've got to know the MDS coordinator. So think about each of the accounts that you're calling on, and then start diagramming who are the individual players in those accounts. And then we can start figuring out and prioritizing who are going to be the most important ones that I need to talk to affect their use of hospice. The person that's going to help you and you need to build the relationship for so that I can compete and win referrals is the person calling them in. Because remember, we said earlier that if we're talking about growing our business because we're competing for referrals and winning that competition, it's somebody who's already been identified as a hospice appropriate patient. So they're giving it to that person that calls it in, and we're creating a situation where that person views us as the right hospice for that patient. Okay? But that other big piece of business, that expansion of how they use hospice services, is rarely going to be the person calling it in, because they don't identify patients. They transmit referrals. So who in that practice do we need to get to that's going to help them see all of the uses of hospice for their patients, the benefits to them as a practice, the benefits to them individually, and obviously the benefits to the patients and families, so that they're thinking about using hospice for more different types of patients. I've got to know who it is that are in a position to identify them. Now, it may be the physician, but in some practices, it could be the nurse. It could be, someone else that's working in there who starts identifying patients who are struggling, identifying the fact that the patients are in and out of the hospital way too frequently, identifying some of those signs and symptoms of somebody that might be appropriate to put on a hospice care program. And then they are able to tell the doctor, say, Dr. Bob, Mrs. Jones is coming in this afternoon, and I really think they'd like you to look and see if you don't think that she might benefit from hospice care. So figure out who it is in those accounts who are key decision makers that would help you to get more hospice referrals, increase the number of patients that are referring to hospice, and then competing and winning and becoming their preferred provider for hospice. When you're doing this, always think about, especially if it's a big practice, what are the most important targets? Who's the key person? Because I can't go in and sell to everybody in an organization, but I can laser in on specific people, figure out what's important to them, get them on board, and then expand from there. If I've got a relationship with one person in a facility, there's no reason you can't ask them who else you should be talking to in the facility. Or would you be willing to introduce me to the social worker on the other wing? Okay, so you need to know exactly who the right people are and then target the right people. Kind of the other flip side of this whole coin is it keeps you from wasting your time talking to the wrong people. By identifying the right people, you're also identifying the people who are not going to be a good use of your time. And so as we're qualifying these accounts, we're qualifying if the account is going to be worthy of our time, and we're qualifying that we're talking to the right people. There's nothing worse than building a great relationship only to find out that the person you built the relationship with is just the wrong person. They're in no position to send you hospice patients, and you've spent maybe months building this relationship. Now, all is not lost. You can get them to help you figure out who is going to be the right person, but you should have an account plan for every account that takes into the detail, really, of how it's made up. And every single practice, every facility, every hospital is a little different. They're different in how they're run, they're different in how they're structured, and most importantly, the people that sit in the chairs are just different people. So you've got to identify them and then build your program and your processes, your sales approach and all your strategies such that it is specific to each of the people in that account that you've identified as being your most important targets.
Lesson 5, the role play. Hi, I'm Jane Doe from ABC Hospice Agency, and I'm your personal service coordinator. I work with physicians' offices that struggle to manage patients with uncontrolled pain. My goal is to help reduce some of the stress related to that and lessen the number of phone calls that you have to field every day. Is that something that would help you out?
Yes,
Okay.
I think so.
Oh, good. So who makes the hospice referrals?
I do.
Okay. So what, does the physician have an agency that he typically works with?
Yes, actually he does. Angels of Mercy.
Angels of Mercy. Yeah, I'm familiar with them. Well, what is it about them that he doesn't like?
Oh, he loves them. He loves them. They're fabulous.
Really? Nothing? I mean, there's never been a bad experience or anything you can think of that they don't do a great
No.
job of?
No, they do a great job.
Okay. Well, does he need a second choice in a provider?
Well, you know, I don't know. I mean, he's certainly never given me any indication of that.
Okay. Well, thanks for your time.
Thank you.
So let's look at that qualifying call and let's talk about what went right and what didn't. She started out with a good introduction and then asked the right question, which was who calls in the referrals. But at that point, things went sideways. So up to there, she was in good shape. But the next question out of her mouth was, what was the preferred agency? Now, I personally think that asking up, especially up front, but at any time, who their preferred agency is just giving them the opportunity to make the case for your competitor and why they like them. So we are not big fans at all of asking who their preferred agency is, and certainly not when you're just out there qualifying. So leave that question out of the toolbox. Then she went down the path of asking, well, what does the doctor not like about them? Well, again, we've asked them who their preferred agency is, which infers that they've selected them and have some confidence in them, and then we've turned immediately around and said, well, what don't you like about them? That's not ever going to be a good strategy, because if nothing else, you're challenging them or putting them in a position, now they're trying to tell you what they don't like about who they do like. So again, keep that question for another day. She kept on with that line of questioning. The questioning wasn't working. Don't keep asking the wrong question again and again. Then she changed tactics and asked what, in many cases, could be a good question to ask, to be the second choice, to be their backup. Except that she did that without giving them any benefits whatsoever or doing anything to set herself apart. All she's done so far is asked, who do they like? What don't they like about the people they like? And then, would you make us your second choice? None of that is going to be a compelling reason for them to use you. Plus, remember the fact that this is a qualifying call. We're trying to get as much information as we can to A, determine if this is the right place for us to be. Do they have patients that would be of benefit to us? Can we provide and can we identify a benefit to them? Basically, we're still trying to find out if this is a good place to call on, and she's already going to the close. Would you use us as a second choice? So all in all, not a very effective call. So let's look at this other call and see how it goes.
Hi, my name is Kara Osborne from ABC Hospice Agency. I'm your personal service coordinator. I work with physicians that are struggling to manage patients with uncontrolled pain to reduce the amount of stress and lessen the number of phone calls. Is that something that would help your office?
Yeah, I suppose.
Okay, so are you the person that calls in the hospice referrals?
If we have them, yes, I am.
Okay, and what is your process for matching a specific hospice patient with an agency?
We usually just give our patients a few choices.
And what types of patients do you typically see?
It varies, but we see a lot of geriatric patients.
So what percentage of your practice would you say is Medicare patients?
Oh, about 60 or 70%.
Oh, okay, great. So what's most important to you when working with a hospice provider?
You know, response time is really important to us. We really want our patients seen right away.
I understand. Is there anything else I should know in terms of what you look for in a hospice provider?
You know, that's really the most important thing. And I guess communication. The doctor really likes to be kept in the loop.
I understand that as well. Thanks for answering my questions. I really appreciate it. And is there anything else I should have asked you that I didn't?
Nothing I can think of.
Okay, great.
Thanks.
So all in all, a very good qualifying call. So let's look at what went right with this call. Well, first off, and I think most importantly, she started out asking broad questions and then narrowed down to get more specific information. She got excellent information by asking good questions. She got information about their patient population, about what type of diseases and disease processes they see, percentage of Medicare patients. And why would we want to know that? Well, obviously, if we're looking for Medicare referrals, assuming that you are, then you want to know if they have any Medicare patients. It also tells you a lot about their patient population. Found out the importance of response time to them, how important that was, and how the doctor likes to be kept in the loop on patients that he or she has referred to your agency. So, in essence, found out the important things to the doctor, found out what kind of patients they had, found out plenty of information to know that they were in the right place, because after all, we're not selling anything on this call. We're qualifying to make sure that this is the right place for us to proceed with the sales process. And, didn't jump in and try and sell them something, didn't jump in immediately and give them a solution before the right time. So the things I want you to keep in mind from this call are stay broad, narrow it down, know what information you're after, get the information, and then close it up, because what you've done is what you set out to do, which is to qualify, and this clearly is going to be a good account for this rep. That finishes up the role plays on asking good qualifying questions.
Let's talk about what you've just learned. When qualifying an account, your number one objective is to find out who calls in the referrals. The easiest way to find this out is to ask. Until you have established who calls in the referrals, that is your only objective. Your first qualifying question in an account should be, who calls in your hospice referrals? Once you have established who calls in the referrals, you can use qualifying questions to find out more about the account. Asking questions like, can you tell me how you select a hospice provider? Or can you tell me a little bit about your practice, will help you to determine how great of an opportunity this referral partner represents. You can use qualifying questions with anybody in an account, and they can be used throughout the sales process. Now that we've talked about the sledgehammer in your toolbox, it's time to bring in a precision tool into your arsenal, the scalpel. So what is this small little surgical tool? It's closing, better known as asking for the referral. Asking for the referral can be very hard for a lot of sales reps. It means being assertive, confident, and laying it all out on the table. But if it's not done with precision and care, instead of getting you a mountain of referrals, it might just turn your referral sources away. Ready to learn how to get that mountain of referrals? Let's go to the next disc.